The seasons are against us.
When winter comes, we will find ourselves in a very difficult position.
2020 could be the darkest winter in modern history.
We were always warned about a winter wave, but a leaked report from the government's SAGE committee today paints a bleak picture. The possibility that deaths from COVID-19 this winter could exceed the number of people that died in the spring. Yesterday recorded the highest number of deaths with the virus since May.
The first wave came just really at the end of the winter. And when we started to see the sharp rise in cases, actually the weather was almost starting to improve anyway. And I think people were very, very quick to comply with all the regulations that came in terms of the lockdown. The virus is killed by heat and it's killed by ultraviolet light, and it takes advantage of people being very close together, particularly indoors, and also the change in humidity. So all of these factors make it much more transmissible in winter.
Today it was confirmed the whole of Nottinghamshire will face Tier 3 restrictions on Friday. It means 1 in 7 people will be living under England's tightest restrictions by the end of the week. Wales is currently in a circuit breaker lockdown. The escalating situation in Nottingham means some cancer operations have been cancelled. Manchester's Nightingale Hospital has reopened, this time to care for non-COVID patients. Today's leaked report suggests 25,000 people will be in hospital in England by the end of November. COVID admissions are on the rise. In the east of England, new hospital cases have doubled over a 5-day period. In the northwest, they've risen by over a third in the last 5 days to 328 admissions in a day. The northeast in Yorkshire isn't far behind, with 303 admissions a day by the last count. To give you an idea of how this compares to March, the day before Boris Johnson announced the national lockdown, there were 859 admissions in England in a day. This week, it's 990. In Scotland, 52 then, and 102 on the latest count. In Wales, much the same, 46 then, and 98 now. And in Northern Ireland, there were 8 admissions in a day at the beginning of lockdown in March. This week, there were 34.
Would you call for a full lockdown again? Do you think that's needed? Is there any way to avoid that now?
I hope we can avoid the full lockdown, which is a very blunt instrument. But I think we're not doing enough at the moment to try and get the transmission rate down. And there's some very, very unhelpful sort of denial going on amongst some sectors of the community and in the world. People who are saying this is a hoax and so forth. I'm sorry, it really is not a hoax. This is really serious stuff.
And in your mind, it's going to get a lot worse before it gets better?
I'm afraid at this rate, it is going to get a lot worse, yes. And we're in for a very bad winter unless we try to get this under control. An important part of that is an effective test, track and trace system. And I just so wish that we'd got that up and running during the summer when we had some breathing space and a window of opportunity.
And on how we protect people from the dangers of COVID-19 while also protecting their livelihoods is a question, much like those early days of spring, still being worked out.
Anya Pop reporting. Well, the Welsh First Minister Mark Drakeford has said he's deeply saddened by the announcement of 37 more deaths of people with coronavirus in the country. Wales is now 5 days into a national firebreak lockdown. Our Home Affairs correspondent Andy Davis is in Cardiff. Andy.
Jackie, this is a significant figure because on Monday, 6 COVID deaths were reported to Public Health Wales. Yesterday it was 7, today 37. Now, it's always quite difficult to unpick these figures. Not all of those deaths will have happened on the same day because it takes time for cases to filter through the system. But it is a striking shift. A number of cases reported like this, not seen for many months. Another statistic today causing alarm here relates to hospital-acquired COVID infections. More than 190 cases in the last recorded week. That's the highest level seen since mid-April. Spiralling out of control is how the Conservative opposition have characterised this issue, calling for an urgent investigation. Meanwhile, we're 5 days into the national firebreak lockdown here, looking at these figures and hoping that this lockdown will work, but being warned once again by the Welsh Government today not to expect to see the impact that this lockdown might have for several weeks yet due to the natural lag in effect.
And Andy, we had a hint today of what happens in Wales after this firebreak lockdown.
The Welsh Government is under a lot of pressure right now to spell out what happens when the firebreak ends in 12 days' time, because they've said they don't want to go back to the previous system of local lockdowns. Well, we got a glimpse of this post-firebreak landscape from one government minister today who said that shops will reopen. And just in the last few minutes, the First Minister, Mark Drakeford, has tweeted, "Pubs, restaurants, gyms and places of worship will reopen as they were before the firebreak," but no indication yet of what that might mean for travel or for meeting up with other people. It looks like it's going to be a few days yet before the new national set of rules for Wales from firebreak to Christmas is unveiled.
Andy, thanks very much.